welcome to Psych Waves. I'm Dr. Teresa Anderson, owner-operator and psychiatrist at the Anderson Clinic in Cincinnati, Ohio. And today I have the pleasure of interviewing Dr. Diana Mercado, who is a family medicine doc and has had her own struggles with ADHD in the past and now has turned that coping skill around and uses it as a superpower and teaches other physicians and other people how to make life work when you're coping and having trouble concentrating and staying focused. So welcome, Dr. Diana.
Thank you so much for having me here. I'm so excited about our conversation today.
Very cool. So as a psychiatrist, I am well versed in all kinds of stimulant medications and things of that nature, but we don't get a lot of opportunity to share different types of coping strategies for people dealing with ADHD on the regular. Can you talk a little bit about that?
Yes, that's a really good question because that's exactly why I became an ADHD life coach because I wanted to bridge the gap, because unfortunately the pills don't teach you the behavioral skills that you need in order to set up your systems to help you function. But I will also say that the pills are the fastest evidence based way of helping you to then be able to implement those behavioral skills that we are talking about. So it is it's a dance, so to say. One is not better than the other, but in combination, both can. It's not an and or. Hopefully, it can be and, but everybody is different, and some people are not able to tolerate the stimulants, or some people are not able to tolerate the non-stimulants, and so sometimes they need both. But like I said, realizing that there's coaching out there, that there's therapy out there, that there's meditation, that there's exercise, there's all kinds of different tools that you have to, not have to, but it would be ideal if you tap into, because when you do that, you open yourself up to the possibility of making a change to the current system that you have that will actually level up your system so that you can support yourself. So I didn't even realize that this whole ADHD coaching world existed. I remember when I got my diagnosis, I was in my first year of med school, and they just kind of said, here's some pills, good luck, type of thing.
Yeah.
And yeah, exactly. And we'll see you next month to see how that works, right? And at that point, I didn't realize that the medications were doing what they were meant to do. The ones that I was started on were short acting and that they would only help for a certain amount of time. And I didn't want to say they weren't working past 3 hours because then I was afraid they would take it away and then I wouldn't even have that 3 hours of quote unquote clarity. And so the tools that you can use with coaching is my goal is for you to realize that we all have strengths and weaknesses. And while most of us always want to dive into our weaknesses, that's actually not what I'm here to tell you about. What I'm here to tell you about is that you need to dive into your strength, into the things that you can do and you hyper focus on because they bring you passion, because that's what your gift is. And everybody has a different gift. And sure, you can spend 3 years in trying to optimize that is not your gift yet. But why spend 3 years when you can spend 3 weeks in optimizing your zone of genius and really living in passion and creating more dopamine? It's like a win-win. Like you get more dopamine because you're aligned with what you're wanting to do, and then that fuels you to continue doing what you're doing. That's why sometimes ADHD is a misname, because people think, oh, they can't focus. But the things that they can focus on, we hyper focus on. That's why sometimes we forget to eat, or we forget, like, we haven't gotten up for, from there. It's like a time blindness. And it's not because we're on purpose trying to be disrespectful to you and your time, but it's just that we're so hyper focused on the activity at hand that it like we are enjoying it. That's why some people can hyper focus on video games, or can hyper focus on a surgery if they're a surgeon, right? Or they can hyper focus on creating this amazing like masterpiece, like, you know, with singing or dancing or with whatever it is. And yet you turn around and you're like, why can't you do the dishes? Well, the dishes are kind of boring, and that's not a task that somebody's like, oh, I can't wait to do. And you can see why, even though you might ask us how long that task might take us, we're gonna tell you it takes me an hour. And like, is that really true? No. But in our brain, it feels like it takes us longer perceived time than what it actually is. So we have this thing that is called time blindness. So either way, you might hyper focus and spend way more time than you intended to on something, or you might not even start a task because you think it's gonna take you way longer than it actually will. And so, with that, it could be a strength too, because, you know, I'm family medicine, and so I'm used to, like, you know, anything that comes, okay, cool. Why? Because everybody else might be nervous about the different things, but to me it's exciting. I don't know what's coming through the door, so it keeps it fresh and new for me. So it might be a kid, it might be a grandma, it might be somebody who wants to talk about birth control, or it might be somebody who I'm about to diagnose with ADHD. So now I'm excited to talk to them. I'm like, oh my god, congratulations, you have ADHD. And they look at me like, you know, I'm crazy. And I'm like, no, that's great, because that means you can do whatever you want to. The trick is finding out, what do you like? And so now it's understanding that you could be a doctor, you could be a lawyer, you could be a policeman, you could be an EMS guy, like you could do whatever, firefighter, like, as long as you're tapped into your zone. Okay,
I
well,
love the idea of tapping into your zone of genius and hyper focusing on that, because so many of those folks have been diagnosed and they spend all their time talking to teachers, talking to parents about the things they aren't getting done and the things they aren't doing right, as opposed to focusing in on what you are doing right and let's maximize that. That's brilliant. I love that.
yeah, and then the other things that you're not doing right, or not right, but that are causing you a little bit of a pain point, but they still kind of need to happen. Like, we still kind of have to get dressed. Like, we can't like ignore that task, right? But it feels like a pain to try to get your kid or yourself out the door, because to get out the door means that several things must have happened. Like, you needed to have gotten, like, you woke up, okay, did you brush your teeth, okay, did you put on clothes, okay, did you take your keys, did you take your purse, did you take your badge? Like, it seems like a duh task for somebody who doesn't have ADHD, but with somebody with ADHD, it feels like a mountain of things you have to climb before you even walked out the door, right? And so when you're aware of that, then you ask yourself, okay, do I have to do this task every day? Probably. How can I automate it? Can I just have a corner where I have my badge and my purse and a charger just in case, they're like all the time? Can I have a place where I can dump all my shoes in the corner? Like, and again, it sounds silly, but if you're not spending 20 minutes running around looking for your phone every morning, or the other shoe, right? Like, you just get out the door so much quicker, right? And
I'm
so
very
certain things you have to do, even though we don't want to because they seem boring. Certain things we need to do in order to get ourselves there. And so if you can't do it, who can you ask for help? Maybe you ask your partner to ask you the day before, hey, where's your purse? And it sounds silly, but the day before, you're not as nervous as you are that morning when you're trying to walk out the door. And so you just find a spotter. That's what I call a spotter. Somebody who you on purposely have asked to help you on a task that is important to you. And so it's not somebody who's going to be judging you and giving you an X because you didn't do it, but it's somebody who you trust that they will remind you. And of course, I'm not saying always delegate everything, but it's nice to have spotters so that when you can't see your own blind spots, somebody can be like, hey, you look tired. When was the last time you slept? Or hey, when was the last time you took some time off? Like, it's good to have those spotters.
I'm very intimately aware of this. My little guy has ADHD, and we get all of his things ready for school the night before, and we have an order of operations every single morning. He only gets a choice of two breakfasts, one of two breakfasts, so there are not too many choices to be distracted by. And it still takes us an hour and a half to get out the door.
Yeah. And sometimes, like, I don't know if my kids have ADHD or not. I'm sure they probably will because it's genetic, right? But one is 4 and the other one's 5. And like you said, like, if I ask them what do they want, forget it. So what I just do is I warm up the corn dog, I warm up the pancake, and I warm up sometimes like a sandwich muffin. So I figured it's enough for them to share if they each want, or whatever's left over I'm just gonna eat. So that way it feels like there's not a fight every morning and I can read their mind. And
There's
then
not an
if
extra decision that has to be made. Yeah. Yeah.
exactly, and if for some time, and if it's still none of that works, I'm like, okay, well then next time you'll tell me the day before, and that's it. Like, you can get mad, but it's not gonna help you or me or whatever. And so now we just joke around when they're having a meltdown, because we're meant to have meltdowns, like it's the human brain. I just say, okay, who's being a bad egg? Like, we just laugh. I mean, I'm not really
Okay with
calling them
it.
a, yeah, you just have to like label the emotion. And I say, okay, I get it. You're mad, and that's okay to be mad. You're not getting what you want, but you being mad there is still not going to happen. I don't have it with me. If I could, I would give it to you. Why would I on purpose want to withhold something from you? So I think with ADHD is realizing that, some emotions that we have might seem like they're grand, and it could be because, again, we don't have that delay, that 2-second delay that somebody without ADHD has. And so we might feel like 10,000 things all at once. But if you're at least aware of that, then you can check in with yourself. Okay, what do I need? Like, have I eaten today? Have I, like, can I take a breath? Like, am I doing too many things at once? Like, because if when we are trying to do task switching, that can be overwhelming, because most people are okay to jump from one task to the another if somebody comes and asks them a question. But people with ADHD, it can take us 20 to 30 minutes just to get back to the task that we were already doing. So if you're aware of that, you can leave yourself a nugget when you're on purpose trying to switch, or you can ask the other person, hey, can you give me a second so that I can give myself a note here so I can return back to that. And it sounds weird asking people to hold on a second, but then they realize you just needed to complete your thought, and then they can have your full undivided attention.
We do a countdown in our house. Like, if dinner's, we're working on dinner and he's working on homework, and say, hey, little man, 15 more minutes to work on your homework, and then dinner's served, 5 more minutes left, and then it'll be dinner time, and it's dinner time, and then after dinner we do the transition. And those, it seems like a reminder against the time blindness, and it also gives them a bit more structure in terms of being able to kind of move forward into difficult transitions. I always thought attention deficit was a misnomer, because it's all the attention with everything, and there's no filter, right? And so I always thought that was really fascinating. I don't know if you've seen this a lot in your practice, but it seems like a lot of folks who go for a long period of time, like yourself, who were diagnosed later in life as opposed to as a child, frequently have some depression and anxiety associated with the ADHD. And once they realize, oh, I'm not stupid, oh, I'm not lazy, oh, I'm not all these things, I just have an attention issue, and that they get diagnosed appropriately, a lot of times those symptoms seem to dwindle a little bit. I mean, they can be comorbid, obviously. You need to treat all of them if they are there, but like a lot of times when folks are treated appropriately, both with behavioral interventions and with stimulants, it seems like the symptoms of the other things subside a little bit. Have you seen that?
Yes, I for me, it's interesting. I was never depressed or anxious, and and I think probably because I was when all along when I was struggling through something, I was probably using like running or some or music or something else to kind of give me dopamine. And I think I figured out quickly that I needed to be in groups, like that groups fueled me. And so I realized that uh, it was in talking to them I could grasp what was important maybe when I thought everything was important, and then I could understand, okay, this is a topic that's important for my work, or this is a topic that's important for my test, or this is a topic that is just important for like my growth or whatever. And so I think that was what helped me not necessarily have like anxiety and depression, but I think had I not been aware enough to use that to help me, those
An
tools,
outlet.
yeah, then I would have probably ended up depressed and anxious um, because then I would have felt like I wasn't fulfilling my potential. Does that make sense? And so after a while during med school, I really had an identity shift because I had to learn to let go of my grades to be something that defined like how smart I was, like that my A didn't mean I was smart. That if my C was like all I gave, like that was my A because I showed up and I gave all that I gave. And I had to tell myself a C equals MD. Like, that's the goal here. What is the big goal here, right? And so, but what I have seen, your question was me as a seeing my patients. I do see that the patients who I do diagnose later in age, they were probably sub-functioning because maybe they had Wellbutrin on board, or maybe they had something else that was hope, like maybe some of them are on clonidine or on something else for blood pressure, and that was enough to kind of offset a little bit
Or
until like
medicating with gallons of coffee.
exactly coffee, or and unfortunately sometimes like it
Right.
is alcohol, right, or it is cocaine, or it is something else, right, that is not as just Pepsi, right, it's something else that can be uh, there. And so the thing is that what I've noticed is that when they do come, I give them all three questionnaires and I'm like, okay, the fastest one I can treat right now is your ADHD. Come back in 3 weeks. Let's do the questionnaires again. And like you said, most of the time, the level of moderate or severe anxiety and depression ends up being mild anxiety and depression, and I haven't even treated it yet. Or it might be that it's not even there to be like anymore, and it was all along because ADHD was untreated. And so
Levels of frustration have so greatly decreased that it doesn't bother them as much anymore.
exactly, they didn't even realize. So now I feel like chronic procrastination and time blindness are like more screening symptoms, I think, because I asked him, how many times did you have to schedule this appointment, or how many times did you miss this appointment, or how many, because you'd be surprised, like sometimes they missed it, right, or they just didn't show up, or and they'll tell me, oh, this is the third month I've been trying to get in, and I put it wrong on my calendar, or I showed up, and like it sounds weird, but like, oh, who helped you schedule this appointment? Oh, it had to be my cousin because I kept trying and I just could not figure it out. And I'm like, well, why couldn't you figure it out? Well, and then they'll tell me all kinds of things, right? So the thing is that sometimes we don't realize that the things that might seem simple might be so many little details that just gets you to freeze and you don't even do it. Or even if you do have it, you still missed it because you were so busy trying to do one
Do
more
all the
thing.
things. Yeah.
Yeah.
We had like a 75% no show rate for folks who had ADHD until we instituted a text reminder system. And now it's an 80% show rate because it's that reminder of like, oh yeah, I have somewhere to be. I have to leave. It makes a
Yes.
difference. It makes a difference.
Exactly. Yeah, I mean the times, like you're right, like we've been doing like quality improvement projects clinic. And before text message reminders, we had a huge no show rate, like regardless of what you had. And once we implemented that, that went down. But especially very obvious with people with ADHD, if you don't remind them, like there's days like if they didn't remind them, I was like, I had six no shows. They're all ADHD, I bet. And we look, sure enough, like 75% of them were ADHD, you know? And so it's just, you know that there's certain things that are meant to be systems. So don't make it mean anything if you do need to use a Google Calendar reminder and you do have to put on there, remind me a day before, 24 hours before, remind me 30 minutes before, remind me 10 minutes before. Like, don't make it mean anything if you need to use that. And planning is a way for you to help your future self, because it's easier for you to schedule a dentist appointment, a doctor's appointment, your massage, whatever it is you want, like 2 or 3 weeks out, than like I need it tomorrow. Like it's a lot harder for you to work in like the current thing than if you look into the future and help you. And of course, I know as the beginning, we're just living in the moment, but the more that you end up being intentional, future focus, then the more likely that it doesn't become like a big stressor in the moment, because you already thought about it ahead of time and you already set up your appointments
I think that's
and
huge.
reminders and everything.
I think that's huge to have workarounds if your friends or family members or clients or patients of these folks recognize, don't take it personally, that they have 1,000 million things on their plates and they're just doing the best they can. But having systems in place that would allow them to be reminded and to know, like I have a girlfriend who without fail is an hour late every time we go. So we just, on the down low, when we decide to meet somewhere and we want it to be noon, we tell her to show up at 11, and without fail she shows up at noon. So you just don't take it personally. It just, this is how it is, and this is how their brain system operates. We're on DOS, he's on Mac. It's fine, it's all good.
Yeah, I mean, you're laughing, but that's what we did for our wedding invitations. Like, we gave the regular wedding invitations to the correct time to my husband's side of the family, who's white and on time. And for my Mexican side of the family, who is, I don't know if they have ADHD or we all have just Mexican Standard Time, we put it 1 hour, ahead of time. And I will tell you, like, I think out of the one or two out of the 60 that came on board on our cruise, like, was late, and one actually came earlier on time because she was a principal and she was like, well, I'm used to being on time, I didn't realize you were adjusting it. And I was like, well, one out of 63, that's okay, right? Like,
Well done, madam, well done. I think that that's just trying to accommodate people's needs and being culturally different versus, yeah, no, that's fantastic. I love that.
yeah, so my husband always, when we're gonna throw a party, he's like, okay, are we gonna give them like parameters? Because he's like, if you give them parameters, they're gonna think they have to walk out at a certain time. Or are you just gonna tell them, come after this time and then they're welcome to go, right? Because again, it's something that we're not like necessarily looking at, but you can easily see why it could be misinterpreted for somebody else if they're like, they're not respecting my time or whatever. And that can lead to miscommunications because, like you said, sometimes we are trying to focus and we did put our phone finally on do not disturb, right? And then we saw the text message and we're like, oh, I'll get back to it right here and then like a week went by and you're like, oh my god, I didn't even reply or I didn't put it into my calendar, and out of sight out of mind. And so again, and realizing that yes, ADHD starts and ends with you. I'm not trying to give you a free pass, but I'm trying to make you aware that this can happen, and then you can communicate with the other person, hey, I'm working on X, Y, and Z. And again, it's not that you're trying to, be rude to them, but you're telling them on purpose what you're working on.
Yeah, open, honest communication is really helpful in diffusing situations in which you might take offense, right?
Yeah, yeah,
Love
exactly.
that. I love that. So, in addition to medications, behavioral therapy, setting time reminders, setting systems in place, are there any other suggestions or recommendations that you have for folks out there who might be suffering with ADHD and not really knowing what direction to go?
Yeah, I mean, realize that whatever you try, even if it's working well, your brain's gonna forget it. It's gonna trick you. It really is. It's gonna tell you you don't need it, that you got it now or whatever, and then you're back
Usually
on
it is.
track, right? You're back on where you were before you tried it, the tool, and then you're wondering why I forgot the tool. So just realize you have a human brain and just realize that every once in a while your brain says, "Oh, that's too easy. Let me go like add some spice to it." And by spice, it might mean let me make it harder again for them. So if you are doing something and you realize that now it's harder than it was, step back and again ask, what was I doing when this was easier? What am I missing? What am I forgetting? Or what happened? Did I add an extra step that didn't need to be in here? Or how can I make this simpler? Be willing to always question it. But there is a really good website. It's called attitudemag.com. And then there is also ADA, which is the adult ADHD website. Like both of those websites are really cool because they give you like webinars and they have blogs and they have different topics about how to understand your ADHD from professionals, and also you can share your own story and send in your how you interpret ADHD or what tools you use. Like don't think that what we're saying here like goes for everybody. It's like I always say it's kind of like a spectrum and you need to try different things, keep what you like and then be willing to unlearn things that you thought were helpful so that you can give yourself the opportunity to remember what the goal is, and as long as you got to the goal, who cares how you got there, as long as you felt supported along the way. And so sometimes that might mean that you do have to ask for different accommodations, and it might not mean that you have to disclose your diagnosis. You could also just be like, hey, I work best, like if you're a physician you could say, hey, I work best with my own dedicated medical assistant, or I work best when
Right.
I have a scribe, or I work best when I have a dragon that I can talk into instead of typing, or I work best by having like a morning heavy and then like an hour break and then like 5 patients and then another 20-minute break and then like 3 patients or whatever. Like you can be willing to ask for something and realize that not asking, nobody can read your mind. So if you don't ask, that's only a disservice to yourself. Versus
If
if
you don't
you
ask, the
ask,
answer will always be no.
exactly. If you don't ask, the answer is always no. If you ask, at least now you're at 50-50 chance. Maybe it'll happen, maybe not, but at least now you have asked and you're a step going forward. And if it's not exactly what you asked, they might be able to do some part of it, and some part of it is better than nothing at all. And so for me, it was starting to use timers and people knocking on my door and asking if I needed anything. It might sound weird, but I mean, that introduced a time awareness that I didn't have before. And so for me, 5 minutes or 45 minutes are the same. It's amazing while I'm talking to you. Kind of sucks when you're waiting for me. So it just, you know that, right? And so when you know that, you're hoping you're like on you are in the receiving end, and you're hoping that as I'm optimizing my strategies, your time is also, and again, it's not that I don't value your time. I do, of course I do. But then you realize that that timer is there for me too, so I value my time, so that I'm aware of where we both are on the process, so that means that I get to eat lunch. That means I get to get home to my kids too. So, so that it doesn't then become something that I love, so all of a sudden something I resent because I still have to do the admin part of it that I didn't like to do. And so, everything that I'm saying here, you don't have to be a physician to implement. Like you can easily look at your schedule, look at you, do a attention audit. What are your attention? Like what are you putting your attention to? Like if you had 100 units of attention blocks, how in a week, where would you say you are dedicating it to your family? Are you giving them 40%? Are you giving them 30%? Or to your personal time? Like, are you giving it 20%? Or to your business or to your job? Are you giving it 90%? Or are you giving it 100%? Because you're always thinking about those tasks you haven't finished, right? So, like, that attention audit could be a quick way for you to realize, ooh, this needs to change, or ooh, I'm on the right track, let's keep going, right? And so realize that anything that I'm saying here is not like novel. It's just saying let's have more fun, because having fun increases the dopamine. And instead of you sitting there and shaming yourself and feeling guilty that you haven't completed your 300 tasks on your list, most people have 20 tasks on their list and you have 300 tasks. Like, how realistic is that? Like, I think you'd rather laugh than cry, because if you're gonna cry, like, you have to just look through there and see, what can I delegate? Like, what can I do myself and I can't wait to do, and only I can do, and what can be done even if it's not exactly how I want it, but it's gonna get done. Or what doesn't have to get done until like 5 years from now, when I'm like bored out of my mind and I'm like, oh, I can't wait to take that up, right?
We have a saying: if you can't automate, delegate. If you can't delegate, procrastinate.
Exactly.
And it's not really that important if it can't be done.
Yeah, exactly. Unfortunately, sometimes, like, and we don't talk about this enough, and I think we should, like, sometimes because we do procrastinate on some decisions, it almost becomes like you get embarrassed of when you walk into a certain room, when you have your thousands of decisions unmade, right? And you're like, oh my god, this gives me anxiety. But sometimes, like, that's when you just take the can and the trash and you just start going, because you're not gonna open all those journals, and you're not gonna wear that clothes that hasn't fit you in forever. Like, you just need to realize that um while it might seem like a big task that you don't want to jump into, like, small little decisions add up, and they can really make a difference, because our external environment really can affect our mind. And so it's good that you just decide, if you think you need to change something, that you try, or you ask for help on somebody that's their zone, like they can do that in their sleep. And you'd be surprised, like, it's so easy for me to go like clean my sister's closet, because I'm not attached to that, right? And it's so easy for her to come to my house and come and clean my closet, because she's not attached to that. She just sees, oh, that doesn't favor you, or let's just let go of it. And for me, I'm thinking of like, but I spent this much on that, and I remember I bought this, right? And so the thing is, like, the items or the mess around us sometimes does not mean we are the items, and it doesn't mean we are the mess. Like, it's just there. So don't get attached to things that your brain sometimes tells you as it to be true, like you're
Don't let it
lazy.
become your identity.
Right, exactly. Like, just learn to be cautious, because um our brain can be tricky sometimes, but our brain doesn't care if you're going for an amazing dream or for just staying small. Like, either way, it's the same amount of work. So you just have to be cautious of what you're allowing your brain to tell you, and be willing to use your ADHD as a superpower, because I mean, it is my impulsivity, it is my willingness to speak up when somebody is in, that has landed me on many leadership roles, that has allowed me to change the way the workflow in my clinic, the workflow in my hospital, and has allowed me to ask for resources for myself and my physicians and my nurse practitioners. And maybe somebody else might have said, well, this is the way it's always been. And I'm like, well, it's not working for me just because this is the way it's always been. You got to decide, like, who do you want? That amazing EMR or that amazing doctor that's about to walk out? Like, you have to decide what really is more important. So realize that you can use your ADHD to think outside the box, to be creative, and to really create change, and that it is both. We need both. We need the non-ADHD and the ADHD brain in a work environment because it's the inclusion that makes the equity happen, and it is that makes the whole organization or the whole community level up, because you're no longer just judging each other, but instead you're learning from each other, and each other's perspectives can really make something amazing.
And I think too, you touched on something as well, that the self-talk is so important in any situation. A lot of my depressed or traumatized folks sort of find themselves what I call in a rut. And I said, your feelings are real, they're understandable, but they're not necessarily true.
Yeah.
Just because your brain calls yourself an idiot, you may feel like an idiot. I understand why you feel that way, but it doesn't make it true, right? And so you have to be really aware and mindful to catch yourself in that negative headspace
Yeah.
before it goes down the sort of toilet bowl swirl of doom, right? It just gets worse and worse and worse and worse and worse. And then you find yourself anxious with a pile of charts that you haven't finished, or anxious with a list of people you haven't called, or anxious with your calendar in front of you that looks like Tolstoy. It's so important to be mindful of what you're telling yourself.
Yeah, that reminds me of that book, the soundtracks. And it talks about like the three questions, like, is it true? Is it kind? And do I really want to think about it that way? Like, is it true that I'm an idiot? Is it kind to think about it that way? And do I really want to hold on to that thought? Like, probably no to all of those, right? And yet our
If you're
brain
being
is going to
aware,
be.
though.
Right. Yet our brain is going to throw you all the examples of why it thinks it's true, but is it really true? Or is it like one time you did one thing and 98 other times you didn't do that thing, and your brain is telling you that because of that one thing, all of a sudden this is
Exactly.
happening, right?
It's
So,
like, I don't know about you, but I didn't go to law school, so why am I trying to prepare a case if I was going in front of a judge? Like, why? Why? That's just the
yeah,
human brain for you.
exactly. Yeah.
That's amazing. Well, Dr. Diana, it's been an absolute pleasure chatting with you. And if folks out there would like to learn more about what you do or the services that you offer, how might they get in contact with you?
Awesome. So come to my website is adhd-lifecoach.com. If you like to listen to my podcast, you don't have to have ADHD to come to listen to my podcast. It's called Beyond ADHD, a physician's perspective. So it's my perspective, so I can talk about whatever I want from my perspective, but I tend to bring people who can explain some tools for us or share their stories or ways that they help support other people who might have ADHD if they themselves don't have ADHD. But if you're a physician and are like, okay, well, that's great and all, but I don't have a week to talk to her every single week. Like, I don't have time to talk to her every single week because I'm not even sleeping. I get you. Come to Costa Rica with me in May and hyper focus for a week so that you can play and learn and implement those tools that you needed to. I know your genius is hyper focus, so come for a week so you can hyper focus and take away what you would have gotten going through something weekly with me. And so, yeah, and guess what? It's CME. So, yeah, you cannot not go, right? There's no excuse here. And I know that most of us leave investing in ourselves to the last thing, but we need to invest in ourselves because it's the only tools that are going to help us to level up. And whether it's anxiety or depression or bipolar or schizophrenia or whatever it is you think you might have, you need to seek resources. You need to make sure that you seek a second, third, fourth, fifth, 10th opinion if you need to until you find somebody you connect with, because you are worth that investment in your mental health, in your emotional health, in your energy, and in your time, because not having the systems to support you are very taxing.
A lot more taxing than if you didn't get help, for sure. Well, thank you for your time. I'm so glad we got a chance to chat today. All right, folks, this is Dr. Teresa Anderson with Psych Waves. Don't forget to like and subscribe. See you soon.